I'm Christina and I am an autism specialist at the private therapy clinic, and today I'm going to be talking about the Autism Diagnostic Interview-Revised, the ADIR. So I'm going to discuss what it is, why we use it, what to expect, and how it informs us in the diagnosis process. So let's first talk about what the ADIR actually is. So it is a structured interview for parents, and it's used globally all over the world, and it's super helpful because it gathers a very detailed background on an individual's developmental history, which is extremely helpful when deciding if someone is autistic or not. You might be wondering why we use the ADIR in our assessments and why we don't just use the observation, or why don't we not just use questionnaires. And we find it informs us so much in getting such accurate diagnosis, to be able to have the opportunity to sit with the person that's going to know their child the most, or the individual that's being assessed the most. No one's going to know them as well as their parents. And so it's so informative for us to sit down and really be able to speak in detail about this individual from being a baby into now. And also sometimes we find that maybe a child goes into the observation part and maybe they communicate very clearly and perform very well, and then we might find out during the interview with the parents that actually this child really struggled with their speech development, and they've had a lot of speech and language therapy which has gotten to them to this point. Or maybe they come across as very social, but then we find out that throughout all their primary school years, they had no friendships at all. So having the interview can just mean that we have such a clear picture of this individual, and we can come up with a really accurate decision. So what should you expect from the ADIR? So your clinician will start by asking you a lot about your child's early developmental milestones. So it's a really good idea to have a little think about your child's birth weight, what weeks they were born in, when they first started walking, talking, toilet training, what was the first social setting you saw them in, so maybe playgroup or nursery, and did anyone else make any comments on their behaviour? When were you first concerned, or looking back in hindsight, what was the first indicator that your child might be autistic? How did we get here today? And then there are 3 key areas that your clinician will be investigating, and that is their communication skills. So that is, how are they able to communicate their needs? Are they clearly understood by others? What are their conversation skills like? What's their nonverbal communication like? So for example, do they use their hands when they're speaking? Would they wave hello and goodbye without being prompted? Would they initiate that themselves? That's actually one that gets parents thinking quite a lot. So it's good to look out for these things, really be observant to your child's behaviour. And then another area is their social interactions. So do they initiate playing with other children? Do they prefer to play alone? Can they play one-to-one, but maybe find group play more difficult? Were there periods of time where they never did play with other children, although now that they do have really good friendships? Has anyone else made any comments, like teachers, on your child playing with other children or not playing with other children? In social settings, does it feel comfortable? Are they able to mingle with other people and make conversation? And thirdly is the repetitive behaviours section. So that is, are they rigid with routine, or can they handle changes? Do they have sensory sensitivities? Are there repetitive behaviours they do, maybe collecting in specific ways or organising things in specific ways? Do they have any obsessions or really specific interests? You might be wondering what you can do to prepare for your ADIR. So don't worry, relax. It might feel or sound like an interrogation. It's absolutely not. And there are a lot of questions, but we don't expect you to be able to answer them all. Although we will ask all the questions so we can get as clear a picture of whoever we're assessing as we can. But some things that you can do to prepare: thinking back at those early milestones, looking at any information you've had from teachers, maybe asking grandparents or a partner of yours also about your child, and about the key areas of autism, as well as making some observations about their use of gestures and how they are day to day with their conversations and things like that, and start kind of thinking if there are any key challenges that you will want to bring up to your clinician. So during the ADIR, your clinician will be taking scores for each question. So there are about 96 questions, and for every question, your clinician will be trying to determine where your child fits in with the scoring. So it's usually out of 3 that we score from. So 0 to 3. And so if you ever feel like you're stuck on a question, it's most likely because your clinician is trying to really determine, they're a bit unsure of where your child fits in with the scoring. And then after the interview is over, your clinician will fill out a booklet with the scoring. And for each area, so for your communication, social interactions, and repetitive behaviours, there is a cutoff score. So if a child goes above a certain score, that indicates that they're autistic. Once the ADOS and the ADIR are both complete, the clinicians will meet, normally with a supervisor, and will watch the recording of the ADOS as well as discussing all the information which was gathered from and that is when we come to decision. Once the ADOS and the ADIR are both complete, the clinicians will meet, normally with a supervisor, and will watch the recording of the ADOS as well as discussing all the information which was gathered from and that is when we come to decision. So once we've come to a conclusion, during the MDT we'll also discuss potential ways which the person could overcome some of their challenges, which would be included in their report. And the first thing is to share the report with the individual who's being assessed and their family, if applicable. So when you receive your report, that's when you will find out if you have a diagnosis or not. And I think if you're someone that is receiving a diagnosis, that can be really confusing. Many people are very happy because they have now got this label that helps describe to themselves and to others about many of the challenges that they're facing. And it can be really validating to know that, they're not being dramatic, or that when they're stressed about certain things, that there really is good reason behind it. So a lot of people are really happy when they get that diagnosis. And it can also mean that they can find their community now. And I really recommend to anyone who receives a diagnosis of autism or a parent who has an autistic child to try and find communities, whether that be online or offline. There are a lot of Facebook groups or even following YouTube channels that focus on autism. And this now allows you to design a life which suits this person and have specific strategies that are autism friendly, because having a child that has autism, you're going to need to use different approaches as well. And if you're autistic as well, you now have the opportunity to design a life for yourself that you can really thrive in. And if you didn't get a diagnosis but were expecting a diagnosis, I really recommend seeking out other assessments and to continue investigating if you are finding that you're having persistent challenges. I hope this video has given you a clear understanding of what to expect from an autism diagnostic interview and why we use them. And if you have any other questions, please feel free to get in contact and we'll be very happy to help.